Tumeingia vijijini, mijini na hata jijini kukuletea taarifa mchana kutwa. Usiku tunaketi kitako, tunadadavua tukichanganua taarifa na makala muhimu yanayokuhusu wewe na familia yako. Ungana na Bernard Ngozi kwenye Open Forum Political Show kuanzia saa 4 usiku hadi dakika zake kila siku ya wiki kwenye
kutoka vijijini, mijini hadi jijini. Hii ni Sound Kanti Talk Live. Kutoka vijijini, mijini hadi jijini. Hii ni Sound Kanti Talk Live.
Good day, ladies and gentlemen, and welcome back for another amazing moment, another amazing time. Kama kawa, the principal remains kama dawa. So I welcome you to the tonight's show, and I would like to tell you that tonight we're gonna have an amazing show about we'll have a communication and we'll have a chat a little bit. But with me says Mr. Studio, I'm having my co-pilot who is Douglas. Welcome, Douglas.
Thank you, Shadizo, and good evening, everybody, from wherever you're watching us. Welcome to the Open Forum Political Show, the show that brings you an analysis of what is happening inside and outside our politics and our society in general. Thank you, Shadizo.
Thank you, Douglas, for that. This is the updates of the day, whereby there are a lot that's happening today, and we'll be checking what's this said. But for those who want to join the show, please join up early as possible. Don't wait until the last minute so that you can want to join up the show. The link is on the comment section. Use the link to join the show. So the updates of the day, I'll be briefing you with the updates of the day that we'll be checking out. The first story we're checking out is a story about the Hustler Fund. The Hustler Fund story is back. Apart from the Hustler Fund, we have the story of SHA, which is also a learning story. It's breaking barriers when days goes up and days moves. It was so silent, but it's beginning to have the magnification because of what's happening. Apart from the story of SHA, also another thing that we'll be checking towards our details all on our tonight is the story of it's one of the story about Auditor General. We'll be checking also the story towards the Auditor General and the small things that are happening, and also other briefly things that we'll be taking you through. But more so, the headlines it has today was beginning with SHA, which has been something that is taking a lead towards the country, whereby people think like Kenya is standing up, but sometimes we feel like, hey, we are still going the same place that you are from, or we are not leaving the same point. We think like we were walking like the person is drunk. You make one step forward, you go back 3 steps. So
Kenya is a crime scene.
So I'm not sure of that what's happening in Kenya, but what I know that we are here and we're gonna have the conversation. So please don't go away, stay tuned, because this is the place to be.
You are watching Sound Kanti Talk Live.
Welcome back as we are continuing rolling. Please, Douglas will take us to the comment section, please.
Thank you for those who already joined us in the studio. Not in the studio, really. In the show, we continue to welcome you to share out the link, invite others to come and have the conversation with us. And engage with us in the comment section. Tell us where you're watching us from. Tell us what you think about our topics today. We have Dahir Abdi who says, hi Bernard and everyone. Bernard is not in the show today, but we definitely tell him you said hi. Tunay Muhammad, as usual, says, hi Bernard and everyone. We have Melkio Ogola who says she's watching from Norway. Hello to you, Melkio Ogola, too, from Norway. And yes, continue to share out the show, like, and subscribe. Press the subscribe button right now before Shadizo comes back. Yeah, I hope they've done it.
Thank you for those who are joining. Let us still increasing the number, and also let us use the link to join Sound Candy Talk. It's good so that you can have the need. But before we roll up, I still remind you for that it is also another amazing moment. But I'd like to remind you of like you can support Sound Candy Talk using the details that are on the screen. Please, if you are on diaspora, you can support Sound Candy Talk using the number on the screen. And if you're in Kenya, you can use the till number. The till number is 516575, or you can use the phone number, which is +254 718 454 then 585. The name for the M-Pesa number will bring Bernard Makoha. Also, please use the details and support Sound Candy Talk so that we can be able to pay the bills, and we can also continue being vibrant as we are rolling towards the conversation. So, fun one, I'll take you to the conversation tonight, whereby we'll bring up the conversation starting with SHA. It's the story of SHA. There's a lineup for the SHA. I'll play the lineup of the video, and then we'll go to the analysis.
Who was defending the Social Health Authority, SHA, and has told off critics of the new health insurance cover, claiming they are a bunch of cartels who've been making fraudulent and false claims to defraud the now defunct NHIF. Speaking during the burial of the late Malava MP Malulu Injendi, President Ruto said there would be no turning back and urged Kenyans to register with the authority. Stephen Leto reports.
With the SHA program reported to be on its sickbed, President William Ruto made it the main point of focus as he joined residents of Malava constituency in Kakamega County. Burial of the late Member of Parliament Malulu Injendi. President Ruto's new health insurance scheme was punctured by the Auditor General with revelations of massive irregularities, including a consortium of companies managing the fund. The head of state quickly defended the model that is now a subject of public debate and lingering doubt.
Nimefanya consortium kubwa. Tukasema we are going to have a consortium of technology companies that is going to make sure that there are no fraudulent claims in SHA.
A report by the Auditor General laid bare how deductions to SHA and deductions from health facilities alongside track and trace solution have ended up in untraceable accounts on a daily basis. President Ruto telling mourners in Malava that no public money will be used to finance the consortium.
And they are going to make sure that that system will not be paid for by the government of Kenya. It will be a fee-for-service facility that will make sure that we protect citizens' contribution. The people who are complaining are the fellows who have been stealing from us. They don't want a technology system that works because they want to continue stealing from us. I want to tell them the stealing is over, my friends. Move on.
President Ruto pointed out low registration of Kakamega residents with the SHA scheme, say there will be no turning back.
Hakuna tena pesa ya umma itafujwa kwa mitandao, hata mujaze makaseti, makaratasi na nini marangapi. Ati ndio mutulazimishe turudi nyuma kule kwa NHIF muendelee na kuiba. Haiwezekani.
According to President Ruto, an audit of the defunct NHIF indicated that 40% of the payments were made to fake hospitals in a wide connected corruption web to defraud the health sector.
Pesa nyingi ambayo ilikuwa inakusanywa na NHIF iliibiwa na matapeli na wakora ambao walikuwa wanajifanya wako na mahospitali. Fake claims, fraudulent claims. consumed almost 40% of the money that was being raised by NHIF. Na hiyo haiwezi kufanyika mimi nikiwa rais tena. It will not happen.
The president called on Malava residents to register en masse with the Social Health Authority that he claims paid the bills of the late MP was buried minutes before 5 p.m. Stephen Leto, Citizen TV.
As I can see, that's what's happening today, and that's what is going on about SHA. It is one of a shameless story, because if they're saying that we're not going back to NHIF, and yet even the SHA itself is not working, so how is it promising people that this will be the best way? And you have seen, like last week, that many hospitals drop out of SHA.
Yes, private hospitals have. Private hospitals had an issue with the NHIF still, with payouts. They were not getting their payouts, but I don't think it was this bad to the point of them deciding collectively to pull out of the scheme. So I think at this point, the debt burden has really deepened, and it's affecting the operations, because private hospitals, private institutions are run very effectively. So such laxity that we see in public institutions has no place in private, in well-run private institutions. So when you see private institutions pulling out of the scheme, then it means that its problems, they just don't want that problem to spread to their side. I mean, if you want us to deal with insurance, then just any other insurance, but not the government scheme. So I think that speaks to how much the problem has gone. And so when we hear the president saying that the people who are fighting the scheme, who is fighting the scheme? It's the Auditor General who has come up with a report exposing, and that's the job as per the Constitution. That's her job, to audit all government expenditures and tell the citizens what is really happening. The Constitution created that office, and it's independent. And I came across something on the internet. That's what I was trying to pull from X. It says a new bill has been proposed in Parliament that seeks to remove the Auditor General as head of the National Audit Office. The bill aims to give the Audit Advisory Board control over budgets, human resources, and other key decisions, limiting the Auditor General's independence. Okay, this hasn't hit our screens yet on TV, on mainstream media, but it has been making rounds on social media. So apparently it's Gichugu who has proposed that bill that seeks to take away, basically just to render the Auditor General useless, or to take away powers from her office. But it's a job to expose them. And these people have been going through, they've been finding ways to go through courts to evade all those things. And they've found a way to work these things, these illegal things that they've brought to us. The housing levies, it was declared unconstitutional, but they still found a way to to bring it into forward into Kenyans' households. There's this SHA, SHIF thing, and the control of budget. Was it last week, a couple of days ago, also came forward and said that some of these funds don't go through the consolidated fund. That's really serious, and as Kenyans we should be concerned, because the consolidated fund is like the national bank account. So if this money is not going through that account, then where is it going to? It means that there are people who are handling it, and it can't be accounted for, because the Office of the Control of Budget is there to oversee government expenditure, to make sure that we are sticking to the budget that we've created. Now, if there's money that is collected but does not go to the consolidated fund rather. And it means that someone has found a shortcut to avoid going through whatever is stipulated by the Constitution. That's why we have issues like this. Now the Auditor General comes forward and tells us the government spent 104 billion acquiring the system for running SHA. But that system apparently is not owned or controlled by the government. So who owns it? That's a question that, we're just wondering. Who owns it? Yeah, and we had an issue. All this money that we've spent, if the president really wanted to fix the healthcare system, and especially the social health fund and universal health coverage in general, he should, if he had spent all these resources in fixing the fund that we had, because yes, it was leaking, and most government institutions have the same problem: corruption and leakages when it comes to money and capital. If he really loved this country, then he would have spent those resources fixing the fund. But I don't know.
Okay. To me, I can ask, like, if Ruto saying that that SHA, NHIF was linked up with people who were stealing on it, and that the one who are insisting that NHIF should be brought back so that they can continue benefiting from it, because they are registered those people that are not there.
Mm-hmm.
So where is the problem to make SHA to work so that it could be efficient to everyone?
Will this thing really work if all its operations are shrouded in mystery? Is it going really to work? Because if it's really committed to make it work, then accountability is the least that he can give Kenyans. I think accountability is but he doesn't answer questions of accountability. He has not even responded to the Auditor General's allegations or report. Rather, it's just fighting imaginary enemies of the scheme. That is a typical manipulator's behavior. It makes you think that you're crazy to evade.
Let us watch this.
And Auditor General Nancy Gathungu has defended her report that lifted the lid on the 104 billion shillings Social Health Authority Healthcare Information Technology System procurement irregularities, saying her report was factual and above board. Gathungu, who appeared before a Senate committee to shed light on some audit queries, said the system was marred by massive irregularities and unlawfulness. As Emmanuel Tonau reports, members of the Senate County Public Accounts Committee have called for the termination of the contracts with the SHA system service providers.
The damning report by the Auditor General Nancy Gathungu, which revealed the illegalities and breaches in the procurement of the Social Health Authority Healthcare Information Technology System, continues to cause a storm. The Auditor General Nancy Gathungu, who appeared in Parliament Tuesday, stuck to her guns, maintaining the system was procured illegally, amidst criticism from some quarters from government on the veracity of her report.
So already I have concluded that there was no effectiveness or lawfulness in the use of public resources under those matters.
Gathungu raising a red flag on the sticky issues of the system, including the repayment model adopted, which allows the service providers to deduct 2.5% of the member contribution, which translates to 10 billion shillings a month.
Kenyans are happy that someone has finally uncovered or pulled the clock off this thing called special purpose vehicles that are in reality special looting vehicles. And there's something you called track and trace, which I would want you to shed some light, Madam Auditor General, that they are taking another 1.5% on this thing called track and trace.
Internal controls are not being followed. The governance structure has problems. There is no risk management, and hence then we have all these issues happening.
Gathungu throwing the ball to Parliament's court on the next course of action, even as MPs called for the cancellation of the SHA deal.
Can we agree before this committee that we want to terminate that contract, and what are going to be the consequences? Because we can't continue to allow people to enjoy proceeds of crime. Let's just declare this SHA and SHIF a criminal enterprise, and we'll close it today.
Role and responsibility for action on the Auditor General's reports is with Parliament.
Our job would be to pronounce ourselves, as I say, prescription. Our job would be to inject and say that now we must inject the head of procurement. We must inject the accounting officer.
The Auditor General's report highlighted several breaches in the procurement of the system, which is not owned by the government, including uncompetitive procurement, lack of payment arrangement agreement, unfavorable contract clauses, and lack of risk assessment, among others. As the impact of the Auditor General's explosive report continues to reverberate across the country, more questions will linger and are begging for answers, with the National Assembly now taking over the mantle to get to the bottom of the issues in question through its duty of oversight.
That's how things are happening, and that's how things are moving on so fast. Even some are even harder to process, but I hope things will be good, things will be fine. So ridiculous. You have seen the report from the other side. You see what somebody is saying there. And we can come to attest that not everything that we see, it's the way that we think everything is. Because when you hear the report from the president, you hear the report from the Auditor General, they are almost like diversing. Also, I want to check also report from the private sector's hospital, and then we combine them together.
On health one more time now, the Social Health Insurance Fund is under threat, with private healthcare providers warning it could collapse within a year without urgent reforms. Appearing before the National Assembly's Health Committee, stakeholders flagged serious inefficiencies, citing low active contributions as a major risk to the fund's sustainability. Mary Moki reports.
It's a crisis in the making, with only 22% of the 20 million registered Kenyans actively contributing to the Social Health Insurance Fund. Operators of private hospitals are struggling to keep their doors open to patients under the scheme. Speaking before the National Assembly Committee on Health, the chairperson of the Kenya Association of Private Hospitals, Dr. Eric Musau, painted a grim picture of the situation.
So unless SHA works, then those who have the option of not paying or are difficult to make pay will not queue to pay. And if this trend goes on unaddressed, we do not see this fund surviving beyond 12 months.
Private and faith-based hospitals defended their move to suspend credit services to SHA card holders, a move they say is an act of desperation rather than reluctance to serve patients. They say they have not suspended services, just the credit advanced for those services. The healthcare providers took issue with the perennial delays in disbursing funds to their accounts at the primary healthcare level. The lawmakers seemingly accepting liability for the failings of SHA.
As government team, initially we were excited with the numbers of those who are registering, so we missed the communication on registering and payment.
The stakeholders also criticized the SHIF reimbursement model, which they argue is unpredictable and unsustainable. The majority of Kenya's health care facilities fall under levels 2 and 3, yet funding disproportionately benefits level 4, 5, and 6 hospitals, which makes up only 9% of the sector, exposing patients to possible financial ruin.
Fast track the process of ensuring that SHA is operational. We need permanent directors, we need staff, we need people in the branches, that fully understand the vision of SHA. What you suffered is a lot of decline in the utilization of a patient, and therefore getting idle capacity and the threat, of sustaining health workers. Chief offers bed and breakfast. You get, they pay, you bed. They are not paying the bill in total.
The legislators said they would explore the possibility of amending SHA to address its inefficiencies, noting that mishandling SHA had the potential to cost them their seats.
That is a benefit package deficit. We will go and say, for people admitted, don't just say surgery and this, even medical care cover.
They can't make us rules because of their own iniquities. We need to call the ministry. The ministry needs to give us a clear pathway.
Mary Mwoki, Citizen TV.
That's how things are on the ground, Douglas. Even now, the private sectors they are saying that the government, the process will never even last for a year because of poor management. And then you see it is contrary to the president's report. President report saying that he will make sure that SHA will be firm until for those posts till last time they will not be able to stay. Where's the possibility? That's the contest, and just overall, all of that has just happened today.
Well, you know how they say talk is cheap, but the actions. I don't know. I don't know what to say about it because it's just setting up the whole SHA shift thing in itself has been a string of big money involved that can't be accounted for. The Auditor General just released the report. It hasn't even started yet. I think it's still rolling out. They're still setting up everything, but it's already sinking our money, and people had an issue with that system, and 104 billion to buy a system. People had an issue with that, and now the Auditor General is just coming out to tell us that you know what, that system that you were told that you spent billions on, but the way it doesn't even belong to you people. I can't. The job of the auditor is just to look through the numbers and to sweep away the noise and find out what is really happening in the world of accounting. So she comes forward and tells us, I've been looking and I can't find anywhere where the government either owns the damn thing or controls it in any way. That is very serious, and I don't know what you're going to do because they keep telling us that this thing is going to work and it's going to fix the problems that we've had in terms of the insurance fund, the social insurance fund, and but people are continuing to suffer, and recently private hospitals have pulled out, and I don't know what might happen. It's very unclear to me. I don't know what to think, because initially I believe that that the healthcare field, the healthcare sector needs some reforms. I believed it, and when you looked at the framework, the initial framework of SHA and SHIF, the whole thing, it made a lot of sense. If you go down to the framework and just read it, the intention was good, but I think just the people who've been the government of the day is just corrupt, and you can't expect them to do anything right. You can't expect them to do anything right.
Okay. As we are also checking towards the story of finance and story of issue and story with the money, I would like to at least drop the story of SHA a little bit. But my viewers, you can just give my opinion. I see on the comment section, somebody is asking, please call him, press J, saying that cash 10 billion per month is so surprised because that money is too a lot, or that money is so much that even some point it doesn't add up very well. The mathematics not mathematics. That's how I can bring it in a simple times. Like the mathematics is not mathematics. It's not mathematics. Yeah. Because when we check out clearly with the calculation, with the theory, I don't know the formula. Maybe metumia subtraction of addition of multiplication. Instead of falling in the board mass bracket of division, then it starts taking the vice versa way, where we are begin to minus first, then we'll divide later. Yeah, we begin to subtract first, then we'll add up later. Okay, as we still continue talking about the story about finance, please welcome to people to join up the studio. Don't wait until the last minute so that you begin struggling, saying that we have closed you out. My payment your best. That's how Gen Z we speak it. Let us check out the story of also the contrary story that has come up to divert the attention of people. Is the story of Hustler.
Oh, Hustler. It does not come to divert. It does not come to divert.
It doesn't come to divert people so that you stop thinking about SHA.
No, actually, it's not even them who brought it up. It's the Auditor General. See, the Auditor General, I think at the end of a financial year, every institution, including private institutions, that have well organized corporate systems, after accountants do their job, recording all the financials throughout the year, towards the end of a financial year, the Auditor General comes. Actually, we are approaching the end of the financial year, 2024, 2025. They do an audit of what has been happening. Then they give a report. So in that report, she raised some questions about the Hustler Fund. That's why it came up on the news. But you can just play it to see what she said.
Let us play first for the story of Hustler Fund. Then we'll check out the audit of that one and the audit.
Explosive Auditor General's report, some more damning revelations have emerged indicating severe financial leakage at one of President William Ruto's flagship projects, the Hustler Fund. The Auditor General, Dr. Nancy Gathungu, has lifted the lid on the loss of billions of shillings at the fund. Her report showing how non-performing loans amounting to 8 billion shillings could just be written off, for it has not been serviced for the last 1 year. The report shows 64% of the money borrowed was not being repaid. Ayub Abdikadir reports.
I now officially launch the Hustler.
Launched with pomp and fanfare, the Hustlers Fund, which was to allow a majority of Kenyans access to credit, according to the Auditor General Dr. Nancy Gathungu, is riddled with financial improprieties. In our 2023-4 financial year audit report, Dr. Gathungu lays bare the inconsistencies in the fund's financial statement. The Auditor General raises questions on the accuracy and correctness of the financial position of the fund, as contrary to a financial statement presented to the auditing team, showing a cash balance of 3.3 billion Kenya shillings. Further analysis revealing a total of 44.2 million Kenya shillings undeclared funds held at M-Pesa float balance at Safaricom, another principal float balance held at other telcos.
I don't know, you are like a magnet.
The audit report also shows high non-performing loans at the fund, with 64% of borrowers either disappearing with the funds or not repaying for over 1 year. As such, the Auditor General is casting doubt of a recovery of 8.7 billion shillings, which has not been serviced for more than 1 year.
Thank you, Honorable Chair. My name is Vivian Nyambura.
The fund, according to the auditor's report, is also losing billions of shillings through duplicate loans, 880,013 loans, amounting to more than 1.6 billion Kenya shillings are duplicated, casting doubt on the accuracy of the outstanding loans. A total of 235,628 loans amounting to 210.4 million Kenya shillings was never repaid and were nowhere on the loans book by the end of the financial year 2023-24. A total of 1,186 underage customers aged between 0 and 17 years also accessed the credit facility, increasing the default rate. Close to 700,000 Kenya shillings was paid to this group, according to the report by the Auditor General.
The Auditor General.
Dr. Gathungu also reveals how 3 service providers could not account for interest on loans amounting to 20 million Kenya shillings. The report also highlights how the fund failed to establish an internal audit function, contrary to the Public Finance Management Act of 2012, which calls for the establishment of appropriate arrangements for internal audit. Dr. Gathungu also states how the fund did not invest in a proper loan management system, questioning 410 million Kenya shillings which was used to match the long-term savings of clients who had borrowed more than 5 times.
I can tell is that they have found you.
A report casting doubt over the sustainability of one of President William Ruto's pet projects, which according to her is replete with a breach of constitutional violations and financial leakages. Ayub Abdikadir, Citizen TV.
I hope you have seen what is going on, and you have seen the audit. The Auditor General, what has now the news is coming out clearly, whereby things are not what we think. They say that a lot of money has been used for the story of Hustler Fund. What's your take about that?
Connie, every policy that Kenya Kwanza, the government, the Kenya Kwanza administration came with, every single one of them has just has things that are not right. Whether it's the housing levy, the Hustler Fund, now SHA, the university funding model, all these things just have things that are not okay with them. And the Hustler Fund was one of the I think it was one of the most important one. They were promising Kenyans that they're going to put money in the hands of what words were they using? The poor ama walikuwa wanatumia
Mama mboga.
Yeah, exactly. Mama mboga na watu wa boda. It was okay, economically speaking, I wish we had an economic in the house. Maybe he would have explained this concept better. But economically, our economy was, had shrunk. So the logic thing to do economically is to put hands in the people, in the wealth creators, so that they have capital to create even more wealth. Economically speaking, I think that was the aim. But I don't know. It's corruption. It's always going to be corruption at the end of the argument. It's corruption, mismanagement, and all those things that are affecting us. I don't know what's the solution for us Kenyans. Maybe you guys should come to the studio and help us come up with a solution to some of these inherent problems that are affecting us. Because every single one of those things is just it's a problem. But one thing I'm always grateful for, it's the Constitution. At times we say that, some people usually argue that these independent bodies aren't really independent, and they don't see the use of them. But I'm really grateful that the drafters of our constitution created some of these independent institutions, in as much as maybe some of them are not fully independent yet, but they still put some check on some of these excesses by the government. Because if if it was back then, Shadizo, I'm telling you for free that this Auditor General, what's her name, Nancy Gathungu, something like that, angekuwa shafutwa. Ingekuwa some time back, because she's a nuisance. She's a nuisance to them because she's always calling them out. Last year she did another report and on the housing levy. She raised some issues on the housing levy and other policies, and she's a nuisance to them, and that's why they brought a bill to parliament that now they want to strip her of those powers to do as the national auditor. Waipeleke parliament. No, when they take it to parliament, then it's going to be politicized and it's no longer going to be credible. But how office is independent, I'm not sure what's the procedure for, for recruiting her. For recruiting her. I don't know what's the procedure, but her office is independent. She doesn't take orders from anybody. She just, the constitution, when the control of budget finishes her job, she takes from there and, she does her report and brings it before parliament. That's just her job. She doesn't take orders from anybody. She doesn't answer from anybody. No one can affect what she does. No one can stop what she does. She just ask for files or whatever she needs to do her audits and her reports. So some of these independent bodies, we should actually be grateful for them. It will take time before we fully realize some of the benefits of really having those independent bodies. Maybe when we have an administration that really respects the constitution and the rule of law, and one that is going to uphold the constitution and the rule of law. So, but for now, we just need to protect those bodies. They're trying to find ways around it, and we're going to be watching how that bill, if indeed they brought it to parliament, we're going to be watching how it goes. And these are not those times when wangekuwa wanafanya vitu chini ya maji and we only come to learn later that wait, by the way, the office of the Auditor General, it no longer exists. Parliament changed the law. I don't think that can happen now, especially now that people are really taking a keen eye on governance issues and what is going on in Parliament, in the executive. What the government is really doing, people are really keen right now, and people are going to be watching. And I think we are on the right way to go. Corruption, I think we're only going to deal with corruption the day we will have someone who really is disgusted by corruption at the helm of leadership in this country and is really going to deal with it. Because some of these issues, they're corruption issues. They're not just happening in SHA or Hustler Fund or the housing levy. We know that they're happening in every sector of our public service, in every office of our public service, in every government office. It's filthy. So I think as a country, we just need a total reset, and I don't know what is going to get us there. So just crossing my fingers and hope we get there soon.
So if we settle those issues and settle the nation, everything will come to a right state.
Pardon?
If we say you have said that we're supposed to settle the nation. So if we settle the nation, everything shall come to the far on. It will continue dragging like it.
Not settle, reset.
Reset.
Yeah, reset the nation. I think last year we were close. I think it has to be violent. We need to shake up the nation and just turn it around. And countries in Africa that have managed to really bring down corruption are countries that have really gone through a phase where they decided, what, enough is enough. All over the world, countries that got to a point where they decided that we need to deal with these things. These countries that really got to a point where they hit rock bottom and they decided that we cannot continue like this. Like Rwanda, I think Rwanda has really brought down their corruption. Rwanda is now one of the least corrupt countries in Africa. I think it's top 3 or something. The systems are working, and everybody is just talking about Rwanda. Rwanda is a really small country, but it's a country that knows where it's going. Kenya hatujui tunaenda. We're just winging it. We're just taking the day as it comes. It's just vibes and inshallah on this side of the continent.
Okay, well, still looking towards that. Also, I know that is good. That's also going on swiftly, or it's sometimes we feel like things are not working. Things are working. We see that we compare with other parts, but I want to bring it to perspective whereby you say that we set the nation shall work. We should not have this kind of the hiccups, kind of the whatever that's been raising up. So if there are other set part, like remember, like the SHA part that we have looked upon, it was settled. Now they build up, but the people are still the same. How will you be able to make sure that even if the people are still the same, that they will try?
That they
will bring the change. Because changing this or setting the place, but the people working or people who come close that's still the same way. How can you handle that?
Either William Ruto is the wrong person to be. Can William? Let me just bring back the question to you. Is William Ruto the solution to the corruption problem? Do you think is the solution to the corruption?
It's not the solution, because also what you think that he's doing is traits like I will make the perspective that every portal that will be there will be closed. Okay, we have not received. They denied that we can close every portal, but before we close every portal, are we making the alignments that make sure that this thing is working, is reliable to the Mwananchi? Because everything here we are looking up is back to Mwananchi. We are not checking everything that was to us. So even when we are doing the analysis, we're not doing the corruption part. We are anyway doing out with the part that this is the loophole. We are looking at the loophole towards the Mwananchi. We're not blocking the whole. We're not making the loophole so that we can ask benefit, but we are looking the loophole so that Mwananchi can benefit. So if what we are doing does not benefit Mwananchi, how do you think that would say like tutafanya hii na hii?
It's almost 3 years since they came into office, and at this point they shouldn't be telling us we will. We already heard what you will when you're campaigning. Like, it's no longer time for we will. It's time for we are, or we have. At this point, it's almost 3 years. It's going to be 3 years in September since this government was sworn in. So I think we are past the time of we will and whatnot. We will tumetenga ama hizo ni stories za campaign huko. Mulishatuambia hizo, that's why people voted you in. At this point, you should be telling us what you've achieved or what you're doing. That is what we want to hear. But I don't know.
Okay, we're not denying that the government is not doing things, that it's trying. But at least, Douglas, if I tell you, like, I'm working on another project, I'm working, for example, for this project, you will see my project is like this way and it's moving this way, and this is the outcome, this is the product, this is how I'm taking my project to another level. But if I'm working to the project, but the project is not taking it to another level, the project is not responding, the project's not, you see, it's not having the benefit, but you still have a lot of doubts. It makes people feel like, hey, Even if we're still investing here, I feel like we are getting into a ditch. So, as Kenyans, what are we supposed to do so that we are just like going into the ditch? We are watching, because when you see what the Auditor General, the conflict that we have said earlier, whereby until they want to remove the Auditor General so that he don't be there, so that he cannot speak about what they have done wrong. If we mess up with the SHA fund, and then the Auditor General comes to speak out, these things happening because we mess up with the SHA fund. The money that you gave out with the SHA fund is not coming back. Meaning we are still inside our debt, and then you don't want the Auditor General to speak it because you don't want the people or the Mwananchi to know that you have messed up. So, what can you say to like scenario?
I think if we just allowed the constitution to work the way it was designed to, it would be a solution to most of these problems that we encounter. Because, you know, when it was promulgated, it was touted as one of the most progressive constitutions in the world, and you know, it came with solutions to some of the problems that we've been dealing with. For instance, in issues like this, if people who are in leadership today just allowed it to work, if he really knows that there are people who've been like leeches in the healthcare system, siphoning money from the fund, and he came up with a new system like he did, but he allowed independent institutions to work. You know, it's the job of money should go to the exchequer. All money that is collected from the citizens, including whatever money is borrowed from outside, should go to the exchequer, so that you know, the controller of budget knows what the country has, and you know, before money is taken out, she has to approve. Like she has to be asked to sign or something. She has to know what has come in, what has gone out. But when we find a way to shortcuts, coming up with alternative funds on the side. For instance, she was before Parliament last week, I guess, and she was saying that the housing levy, you know, it's a fund that was created by this government. It has not existed before, but that money does not go to the consolidated fund. So basically, that's just, that money is just stored somewhere, and you know, she can't account for it as the controller of budget or the person who keeps the expenditure of the country. So there's someone else who holds that wallet, and he or she can withdraw it anytime they please, and you know, it's money that can just be lost. It can just disappear, and it can never be traced. So if the government is doing things like shoddy paperwork like that, then how can we trust them? How can we trust the president when he comes and tells us that he's going to seal all the loopholes within the healthcare system so that the fund works for Kenyans? I don't see how that is going to happen. Yeah.
Okay, thank you for that. Let us check out this so that we can continue knowing what's not happening inside our nation.
Every Kenyan is asking. The Auditor General has submitted a report to Parliament about the Social Health Authority procurement of systems. The amounts of money involved are crazy. 104 billion Kenya shillings. In your report, you have listed a litany of transgressions of the law, the Constitution, the Procurement Act, the PFM Act. You have said management was in breach of law in several instances. You've said it almost 10 times. What these commentators on Radio in the Morning were asking, now that the Auditor General has said management is in breach of law, we are waiting for Parliament to go and whitewash the report. OAG, I can assure you that if that report is to come before this committee, we are not going to whitewash it. If you have gone to the ground, you have asked for documents, and you have found that 104 billion was spent on a specially permitted procurement procedure, which is contrary to the Constitution of Kenya. Do I need to get a governor to come and justify that the SHA was proper? And yet you are the one with the constitutional mandate to tell us whether resources have been used lawfully and efficiently. And so we must have this conversation. Once the Auditor General has said that the procurement of 104 billion of systems under SHA violated Article 227 of the Constitution of Kenya, violated the Procurement and Assets Disposal Act, violated the PFM Act, was not value for money. There were clauses and provisions in there that were not competitive. People were being locked in. There was a software as a service arrangement, which then does not confer ownership of the system to the citizens of Kenya. And you have said management is in breach of law. What else are we waiting for? Shouldn't we then be asking for administrative action, for people to be fired, for people to be investigated, for people to be arraigned in court? And those people are not just the people on the government of Kenya side, but including the system vendors. If there's a breach, then perhaps there are two parties to it.
We cannot continue using a system that is clearly a proceed of crime. It appears that the only people for whom SHA is working are the ones who are getting these commissions, the 2.5% from my monthly contribution. You have told us that they have to be paid on a daily basis. And yet the facilities themselves do not get similar treatment when they ask for reimbursements for their claims, Madam OAG. So can we, with finality, say something? Can we take drastic action? Because some of us do not mind being a bit rash if we are going to do something that is in the best interest of the country. Can we agree before this committee that we want to terminate that contract, and what are going to be the consequences? Because you can't continue to allow people to enjoy proceeds of crime. Let's just declare this SHA and SHIF a criminal enterprise, and we'll close it today.
Every report that comes before you, where I pay attention to Article 296. So already I have concluded that there was no effectiveness or lawfulness in the use of public resources under those matters. Then I have the third section that now looks inward into the entity in terms of governance, in terms of risk management, in terms of the internal controls the Honourable Member is raising. And I also give a conclusion. And I say these matters have affected internal controls, or internal controls are not being followed. The governance structure has problems. There is no risk management. And hence, then we have all these issues happening under effectiveness and under the opinion matters fiscal. So my report is very clear on that I have already pronounced myself on the issues that were not lawful and that were not effective.
Our job would be to mete out punishment, to recommend administrative action, to recommend investigation and prosecution. The Auditor General has done the diagnosis. It is now time for Parliament to do the prescription. And that prescription is not about reopening the case, because it's the Auditor General that has done the case. The role of Parliament now is to prescribe, and to prescribe the stiffest punishment, even if it means discontinuation of the system, debarment of the service providers, investigation and prosecution of accounting officers, striking off the professionals from their professional bodies, the procurement professionals, the legal professionals, the accountants. I think that's what you're saying, that now that is the job of Parliament, to do the prescription. You have told us the patient is sick. We are now the ones to prescribe. And I hope that the National Assembly and all the various committees can speak in the same language to provide hope to the country, that these big issues you have raised regarding 104 billion Kenya shillings is not going to get lost in the mud of political.
That's how things are working, and that's what the debate today. We're talking about story of pesa. Umeona? Nani is asking if the pesa that we have speaking of what you're speaking, the governor is not that is the right thing. Ama he has the money is well spent. Mbona anakuwa na hofu when the Auditor General is doing the work? Mbona anakuwa na hofu wants to say that we must be informed so that we can He's having a lot of stories. So where's the problem now?
Unajua mwizi lazima akuwe na wasiwasi ukianza kumchunguza. Hiyo ni kawaida. People who are guilty hate scrutiny. If you know you're guilty, there's no way you're going to just allow someone to scrutinize you, because eventually they're going to find the faults where they are. Also, we don't expect them to just let her do her job, if they know that they're doing something wrong. But I do agree with the senators there. Sifuna and who was the other one? Juang or something. Saying that it's just, discontinue this thing or something, because it will continue to sink our money. So far, we've spent so much on it, but nothing. And it's not bringing forth any solutions or anything. Just like all the other mini projects that Wamepitisha, all the other solutions to our problems that they've come up with in the last 2.5 years of their rule, the reign. I think most of them zimekuwa reverted, because they're hurrying up. Huwezi badilisha tu kila kitu. Huwezi ingia somewhere and you just overturn everything. I think that's the problem. Wanataka ku overturn kila kitu. It has to be gradual. They came and they overturned the funding model, and I think wanakuja, they want to overturn everything, and they think that they are the solutions to all our problems. And some of these things that they're starting, they really, I don't know if it's short-sightedness or what, but they're unable to oversee most of these things to the end, or oversee them correctly, and wanabaki na a problem in their hands, and they just can't move it forward, and inabidi they just go back to whatever was there before, because now they have a problem in their hands and they don't know how to proceed with it, so they have to drop it. And eventually they are going to have to drop this SHA thing, because it's not working for everybody. So who are they building it for?
Not only SHA, speaking of many things, but the worst thing with the story of SHA is that it is painful. Me paying SHA, and yet when I go to the state service, it's not. It's so frustrating. And then this one question I asked, and I've never get the answer, whereby if, like the ATM, if I'm having an ATM card, a Visa card, I can swipe in any bank of the same kind. Why should I having my ATM card, my medical cover card, but it can only work in one hospital? Why do one medical cover works in one hospital that I must register in a certain hospital? It can't work to another hospital. So if I go to another hospital, it is useless. I will just have to pay again.
What card?
Like, for example, like the way NHF used to work. You've seen, like, at first it was open, but when like they bring it close, whereby it used to work only in one hospital.
Okay, I'm going to get a question.
I'm saying, like, this is a question I've been asking myself so much, whereby you find like the medical cover cards or visas, they only work in one hospital. Whereby if you have registered in Juja in a certain hospital, you can't go to Thika and be treated in another hospital. You must go back to Juja, the same hospital, so that you might be treated. While if we check the bank, we normally have just one visa, but you can swipe even in Kakamega as long as it's the same bank. Why could not the medical part they bring it like that?
Okay, I don't think that's how it works. See, as long as you have a card that is active, you can use the insurance in any hospital that is NHIF accredited. I don't think you can only use it in one hospital. I'm not sure though. I think I've had something like that before. Although I've never really used NHIF. The last time I was on NHIF, I was there as a beneficiary, but I've never really paid for NHIF.
I mean, I paid for NHIF. I can't lie to you. I've paid for NHIF for at least 3 years.
Has it helped you?
Sometimes even you go to be to hospital, then they will measure you, and then they tell you, like, after consultation, they'll tell you now NHIF can't work anymore. You have to pay for the drugs. And then I stopped paying it.
Because okay, so those are the problems that SHA was here to address, and I've said it before that if you went through the initial framework, the intentions were good and they had a really good framework, but I'm not sure. I'm not sure they get it wrong. I'm not sure they get it wrong, but I think the problem, it has to be you know, they have a track record of employing people who are incompetent, underqualified for some of these roles. So I don't think that's a problem just at the top. I think it runs deep down into the whole government system. So could that be the problem?
I don't know, even me, because I'm not understanding it. Because Douglas, if I'm having like a problem, I'm sorting out the problem. First, I check the rabbit of the problem. I check how can we bring in the permanent solution towards it. You don't checking out juu hapa panavoja, wacha tudonge kijiti, lakini hiyo mabati ibaki tu. And yet bado hapo kunafanya nini? The thing is, if the mabati is so corroded, get out the old iron sheet, bring another new one, place it and cover to make sure that the solution is permanent. But hiyo kufunikanga like tunataka kuweka viraka kwa nguo. Tunatoa, tunajifanya tumetoa, but yet we still go bring back the same mabati. Okay, and thank you for those that are still joining, and I welcome you inside the show. Please come, let us speak this as we are winding up. I see somebody called Big J. Big J anasema, I'll play the comment for Big J. Anasema huyu hata kama baba ataamua kumsupport, atashangaa kichapo atapata na okay. That's how we amesema na nimeicheza hivyo. That's why so that nimesoma maneno yangu. You've also contributed the comment. Please, I urge you people, let us continue vibing up, let us continue speaking up, let us continue sharing up. But one thing I want to remind you is we are still supporting Sound Candy Talk. So as we are supporting Sound Candy, we are using the following details that are on the screen. Use the details on the screen to support Sound Candy Talk. Number one, you can use the pay till. For those who are in Kenya, the till is 516575. And for those who are using M-Pesa, you can send money on for you. And the number is +254 718 454 585. And the name is Menard Makoha. So use the details, please. Cheza kiwewe, tingiza ya wavu. Unaona leo nimekaa hapa hata kuna kitu nakunywa, hata kuna kitu nimeletea Douglas, because even I don't have the money to buy for Douglas. So I help mayors so that we can keep on the show. Also, they can pay up for the bills for StreamYard and other bills. So I want to urge you people, please, yes, let us tucheze kisisi. Fanya mambo ikuwe sawa ama aje. We're just going for a short commercial break. We'll be right back.
Kutoka vijijini, mijini hadi jijini. Hii ni Sound. At Sound Candid Talk, we provide live UHD broadcast for church services, talk shows and podcasts, weddings, live bands, products and services launches, webinars and trainings, Zoom meetings, conferences, seminars, exhibitions, and virtual concerts.
Welcome to Sound Candid Talk News Special Edition. Be sure to subscribe, share the video widely, and give it a thumbs up. God bless you. This is the story of Frank Okoth, a 19-year-old Kenyan whose life is nothing short of a miracle and an inspiration. A young man who, against all odds, survived 6 gunshots during the tragic June 26, 2024, Gen Z protests in Nairobi. Frank is an orphan, raised by his aging maternal grandmother after losing his mother at the tender age of 8. He never knew his father, a result of a teenage pregnancy, and life has dealt him blow after blow. Frank and his grandmother have faced unspeakable challenges, including surviving 2 devastating slum fires that claimed everything they owned: his late mother's documents, birth certificates, and school papers, leaving them with nothing to rebuild their lives. Forced to drop out of school in Form 2 due to a lack of fees, Frank started doing manual jobs to provide for his grandmother. But on June 26, 2024, everything changed. During the protests, Frank joined other Kenyan youth to exercise their democratic rights, peacefully demonstrating against unemployment, rising living costs, and rampant corruption. But the unthinkable happened. Police opened fire on unarmed demonstrators, killing over 20, injuring many, and leaving others unaccounted for. Frank was among the victims, hit by 6 bullets, yet by God's grace, he survived. After a series of life-saving surgeries, Frank can now walk again, but the bullets left a lasting impact. He can no longer perform heavy-duty jobs to support his grandmother. And their iron sheet home, deep in the slum, is inaccessible by vehicles. In case of a medical emergency, help is far out of reach. To make matters worse, the slum is plagued by insecurity, with daily cases of muggings and robberies. Despite all these challenges, Frank dreams of finishing his education, learning a trade, and building a better life for his grandmother, the woman who has stood by him through every storm. This is where we need your help. In the short term, we aim to move Frank and his grandmother to a safer home where they can access medical care and live without constant fear. Long term, we want to support Frank in completing his education, learning a profitable skill, and starting a small business. I've faced so much, but I'm still standing. I want to work hard, take care of my grandmother, and make her proud. I just need a chance. You can be the change in Frank's life. Every contribution, big or small, will go a long way in helping this brave young man and his grandmother rebuild their lives. Let's come together and help Frank fulfill his God-given destiny. God bless you. Don't forget to subscribe, like, share this video widely, and stay tuned for more inspiring stories on Sound Candid Talk. Send your donations to Sound Candid Talk, support Frank Okoth account. The link is in the description below. Together, we can make a difference.
Welcome back, and I want to appreciate for those who are still watching. Please share this video and invite somebody to watch and be part and parcel of this. Leo team joining meamua leo kwenda mgomo, but I want to welcome you. Let us come together so that we can wind up together, or we can sum up together as we are moving on to bring Kenya in a better place. So as we are continuing 50 Douglas, this is one of the issue story I've been sent on WhatsApp. Let's check what we check on it, and then we see what's not going on.
My name is Lindsay Kiptines, Ambassador of Kenya to the Kingdom of Thailand. We are addressing a serious problem of human trafficking affecting Kenyans being trafficked from Kenya to Myanmar, where we have scam compounds, and most of the Kenyans arrive in Myanmar through Thailand. Majority of those being trafficked are young Kenyans aged between 19 years to 35, and most of them are job seekers in Kenya. And by the way, they are qualified people. We have had cases of university graduates being trafficked to Myanmar scam compounds. Virtually, we have helped Kenyans that have been scammed or trafficked from North Rift, from Western Kenya, Nyanza province, from Nakuru, from Kiambu, from Nyandarua, from Murang'a, and Mombasa, where we receive majority of those being trafficked. And Nairobi, of course. Once they arrive in the compounds, they are received by armed men at the gate, and then they are ushered into the compounds. They are given 5 mobile phones and 1 laptop, and they are taken through scamming training for 10 days. Once that training is done, they are told to do the work of scamming and performing other online crimes like cryptocurrency scamming. And most of their clients are Western citizens like the US and other places. What I want to say here is most of those young Kenyans who come here, they are good in the application of technology apps or in the application of apps, which they then use to scam victims in the US. Since 2022, we have rescued over 150 Kenyans. Currently, we are trying to rescue 45 Kenyans who have sent an SOS to the embassy and also to the State Department for Diaspora Affairs. And we have engaged different partners, NGOs, the government of Thailand and the government of Myanmar and other institutions to help us to get the Kenyans out. So I want to make an appeal to Kenyans who are looking for jobs out there. Please, if you see any online advert for any jobs in Thailand, conduct due diligence, get in touch with the embassy. Get in touch also with the State Department for Diaspora Affairs. Give us a list of jobs that you have seen. We will conduct due diligence and inform you accordingly. This will avoid you and your families, getting you the trouble of being trafficked to Myanmar, where you suffer, as we have already talked about Kenyans suffering and have to be rescued out. Secondly, as a preventive measure, please, I also want to appeal to you to become our ambassadors and talk to Kenyans. Discourage them from applying for such jobs. But the most important thing is just make sure that you find out if the jobs being advertised are legitimate or not. This is the only way that we can prevent human trafficking and the suffering of Kenyans.
I've seen the story of human trafficking is being rising out, and it's so shaming. And I would like just briefly let us brush over it so that we can go to other stories. We still have a lot of stories. We sum up with them so that we can call it a day. But you see this story of people being abducted, being taken away forcefully. It's becoming something that is alarming in Kenya, and we have to do something about it, or we have to speak something about it. What can you speak about that?
Watu wakae nyumbani.
Wasiende hata kazini.
Watu wakae, mbona mnapenda kutoroka Kenya? Mkae Kenya mjenge. Unajua, the problem with Kenyans is we don't want to stay here and build our country. Sisi tunataka tuende hizo nchi. We want, okay, it's an us problem. We want tunataka tuende sijui Malaysia, Singapore, America, UK, those countries that have developed themselves. We don't want to stay here and build our own country, build our own issues. kita maandamano mnasema oh your revolution failed, then you guys mnatorokea those countries, the Warabu and Asia, watu wanaenda wanateswa huko, then you start crying to Kenyans for help. Okay, I'm not victim shaming anyone, but as they've said, when you get some of these opportunities, find the due diligence. Okay, I've not interacted with any of these agencies that recruit people to go and work abroad. But I've come across such many cases, especially people who go to the Arab countries to work there. So unaenda, you're promised that there's a job that's waiting for you, then you book a flight, you pay the agents, some of them you pay them, then ukifika huko unapata there really was no job. Ni kwenda kutafuta, there also there are always these stories. I don't know, maybe for those of you who've worked with them, who've navigated that terrain of foreign work with an agent, kuja in the studio, tell us how it goes, what happens, the upside, the downsides, so that we understand what really goes wrong. And maybe we can inform those who are seeking to go and work abroad what they should avoid and who they should work with and how they should navigate those uncertain.
Okay, so you're going always like that, or I just ask people to come in. I will share one scenario whereby some people have gone to work, like remember, like such in countries, but find somebody living Kenya with not the working visa, leaves Kenya with a visiting visa. And then he find himself in trouble because he left Kenya going to abroad using a visiting visa. You see, now if you are using a visiting visa and you are going there to work, how can you work with a visiting visa?
Okay, I have some friends who've mostly gone to these Arab countries, Qatar, Saudi Arabia, and the likes, Bahrain, those Gulf countries. So what happens is unachukua visiting visa. So ukichukua, it's actually called a tourist visa. Lala is here, he's abroad, maybe atatuambia exactly how it goes. But from what they were telling me, ukichukua a tourist visa, it's valid for 3 months. So unaweza kaa in that foreign country for 3 months. So when you go there, those 3 months ni kusaka job. Yeah, so if you are lucky to get a job, then the employer is going to help you now get a working visa. A working visa is I think 10 years in Qatar, 2 years in Qatar, then it expires, then you renew it. But I think Lala can explain those things better.
Welcome, Lala. How are you?
Okay, Shadizo and my brother. I'm good, Shadizo.
Yeah. Also, we are good inside the studio, and I would like to engage you a little bit. There's a lot happening. I know you have come up between the show, and we are discussing out the story of people being kidnapped. Most of people who left Kenyans we left Kenya to Europe or to abroad countries without clear proper documents or without clear way that they left Kenya. So you find there is appeal that whereby somebody is appealing because somebody can get unite for a certain certain company to be taken abroad. Supposed to have to check where it was the company. What can you speak about that?
Oh, hi, good afternoon or good morning, everyone behind the scene. And it's good to see the two of you there. Immigration issue is a very serious subject that should be covered very carefully. And let me just talk about the U.S. The U.S. we have what we call the Statue of Liberty. This is supposed to be an invitation to anyone in trouble overseas, somebody that might not be welcome. This was a welcoming ground. All these white people came to the U.S. With no documentation. They were all processed while here in the U.S. Okay, but of course, people, when you get something now, you want it to reflect your own developed new values. So now it is difficult to welcome those that look different than us. In the US, if you look a little darker, you may have a harder time being welcome. That's the reality of the migration. Or every country, the question that you're raising here is an interesting one. I can use the US as an example. If you want to come to the US, you may come on a visitor's visa, B1 or B2, or you may come as a student, F1, F2, or a professional J1, J2, and there are different categories of visas that you can use. There were times when it was much easier to change. When you're already here, you can change from a business visa or tourist visa, whatever you want to call it, to a work visa. But I think they closed that one. So if you want to come to the US, then you must find a visa that allows you to come in, and then engage a lawyer. If you have a job, if somebody wants to employ you, or you have a school that you want to go to, then they can process it for you to stay here. Then there are those who come as tourists or visitors visa, and they overstay. And when you overstay, then you lose your status. You are not a criminal. You're just a civil, it's a civil right issue. Okay, so it is not that you are a criminal. You're supposed to be. It's just that you overstayed. So you need to get out of the country, or you need to do something that can allow you to reinstate your status as a legitimate person in the US or other part of the world. And I think it is almost similar with other places around the globe. Even in Kenya, when you come in as a foreigner, you have to get proper documentation. And usually at the airport, they make sure that you have a visa that allows you to enter the United States. You cannot enter without a visa. So most of the people that are here are legitimately here, only that they are overstayed. And that means they need to reinstate their status. But now the administration making it very difficult to do that. For example, you're here and you overstayed, and you may be in court working with your lawyer, but then the system may want to get you and grab you for a minor thing so that they can have a reason to deport you. So it's a very touchy issue at this moment. And it has always been that way, but I think with the Trump administration, the immigration is one of the things that he ran on. And so we have a lot of problems. I may even share with you a video clip where lawyers have addressed this issue. For example, the one that I just got states that I think they have been doing this now. They are targeting places where maybe a lot of people of color congregate, because the idea behind this administration is to make America great. Make America great means make America white again. So the darker you are, the worse for you. So I want you to have that perspective, because I think it has been missed because people are trying to be very diplomatic, but we are having issues when it comes to racism. I'm a pastor, so I talk to a lot of people in the United States, and the administration know who I am. So I know this is an issue, and so if people are praying, pray for us so that we don't get a lot of harassment, and that people also will be free enough to find lawyers to help them stay. So that is the status of our immigration. For majority of those who are here without proper documentation, they need the service of a lawyer. That's it. The other aspect that is not covered is that if you take all the illegal immigrants out of the United States, the U.S. economy will fall. In other words, they need these illegal immigrants. The people who are keeping them are the Republicans, they are the rich people that need their services because they pay them minimum wage, okay? Very little wages, okay? But then when you hear the problem is towards the immigrant themselves, not the people employing them. Like right now, I think there's a state in Montana, the state almost going bankrupt because all the Mexicans who are working in the farms have gone. So food is rotting, and they are mad. Tonight, I think there's going to be a because even these are the people who voted Trump in, but now they don't know what is coming. So they are very angry with Trump. So it's not right now. It's not even just the Democrats, but now it's the Republicans themselves because of that immigration issue. So it is a situation that is very fluid. A lot is going on right now, but people are afraid. Those who are there legitimately or illegally, there's nobody legitimate here, but illegally here, they're scared because of people who simply want to show thorax, and I eat thorax because they don't like foreigners, they don't like blackface, they don't like non-Americans. So this is their chance for revenge. That's one of the problems that we are having right here. But at the same time, there's a lot of false fighting against what has happened. So I think in the long run we'll be okay. Things will level out, and they have to change. There's no way they're going to kick out all these people. It is impossible. They need them more than actually they need them more than this immigrants need them actually because many of them have a home to go back to. But the economy of the U.S. is suffering right now because of immigrants are afraid to go out. Some are just in the houses. Churches are empty. Some of our churches that we have are empty because there's a belief that they are targeting those churches. When you go to worship, when you come out, you're arrested. And this has happened. And this happened many times. I know people that have been targeted that way. So this is what's going on. But there's a strong organization. People are organizing against this, what we call racist move to pluck certain kinds of people, not everybody. There are those that come from other places, they organize for them, they bring them in here, they go give them apartments, but as long as you blue eye look white, then you get that kind of acceptance. So the idea is purely racist. So I want Kenyans and other people to know this is what is going on. And of course, they use what we call wage issues. They use extreme situation that things that we will not we will agree upon. Things like abortion, things like sex, gay marriages, and all that. They use that very effectively to get their point across. As long as Trump is for this, therefore it's okay, but underneath the other things that are going on. So these are some of the challenges that for you there in Kenya and other places, remember us in your prayers and the thought that people may not be harassed. Back to you.
Thank you, Lala, for that submission. Indeed, you have shown us that.
So much echo, a lot of echo. What's going on? Is it my side or your side?
When I open your mic and we both open the mics, the one that brings echo.
Okay, thank you.
Okay. Thank you, Lala, for that submission. We are moving on swiftly. Please welcome for other people who are still on the comment section. Luambia mapema and your best. Don't wait until late minutes so that you can want to say that. No. Come as well as possible so that you can have freedom to speak. Lala, I want to take another gear that will be checking out what's happened today. Lala, today was something embarrassed that happened. I don't even know what to speak or where to begin from, where until people are snatching my microphone from the others. But let us check out this so that we can have the conversation.
Now, a funeral service for 3 children killed in a road accident in Gichugu, Kirinyaga County, took a dramatic turn when chaos erupted after politicians were barred from addressing the mourners. Tensions flared as a bishop from the Full Gospel Church of Kenya, who was set to preside over the ceremony, walked out after a section of mourners turned hostile, demanding that the local leaders be allowed to speak. Citizen TV's Ben Kirui has more.
Confrontations and shouting matches rocked what was meant to be a solemn occasion, a burial ceremony of 3 pupils who passed away in a road accident in Gichugu, Kirinyaga County. Tensions flared when Kirinyaga woman representative Njeri Maina defied the presiding bishop's directive to steer clear of controversial political topics. In a dramatic moment, Bishop Simon Munene grabbed the microphone from her, triggering an angry reaction from a section of mourners who demanded that the MP be allowed to speak.
Because let me answer you fair and fair. Because this is a burial ceremony, not a political marriage. You'll do that.
Bishop kwena sisi okava nario horo wa SHA na dona gwetondo.
Listen to me, please. Not contention, please. Thank you. Thank you. You have something to say?
Emotions ran high as the situation spiraled out of control, with irate residents shouting uncontrollably and disrupting the entire ceremony. The unrest escalated to the point where Bishop Munene was forced to flee for his safety as a group of agitated youth turned against him.
We came here to do. We came here to preach the gospel.
Earlier, the bishop had urged politicians to respect the occasion, focus on paying tribute to the departed and stand in solidarity with the bereaved families.
Hapa tuongei SHA inafanya kazi ama ifanyi. Atuongei kama barabara zinajengwa ama hazijengwi. Because if we start doing that, hawa watu ambao wamefiwa, ambao wanaomboleza na wanalia, na ndio wamefanya tu hapa.
Sisi kama viongozi lazima tuzungumze. Manake hawa wananchi wanaumia.
The intervention of Kirinyaga Senator Kamau Murango helped restore order, allowing the burial ceremony to proceed after the politicians got their way. The ceremony was in honor of 3 pupils who tragically lost their lives in a road accident along the Kimunye Gatugura Road a week ago. Ben Kirui, Citizen TV, Nairobi.
That's how things are happening on the ground, and that's how things. I hope Lala, you have seen it. Mpaka watu wananyang'anyana mic. Siku hizi kwa matanga tumekataza hapo, sasa tutaki, kama mtaki tunachukua mic. Ndagila sana na wewe.
Okay, maybe personally, I saw that story and immediately my mind was in support of the preacher. But then as I watched, I was so infuriated by the fact that the people chased him away. They wanted to beat him up and he had to run away because, I was hoping that preachers will get to that point where they stand and tell politicians that, no, you cannot do this here. this a burial ceremony or this a church, or that is wrong. Because I think they should respect funerals, bana. See, just come to the funeral, tumekuja kuzika kids, then when we are done, and then it will pale. Of course, there is a market center, a place to, the people will follow you, and then you come muongelee siasa. Just respect the funeral. So personally, maybe I was in support of what that preacher did.
Wengine wanaogopa gharama. Pia wana PA system, wanataka tumie PA system ya matanga.
PA system ya matanga. Unaona kama during that time when they were burying General Gole. Remember that time?
Yeah.
So they agreed they are not going to talk about politics during that funeral. And they didn't. They just buried the good general. And when they were done, Uhuru, see, your time they were still with Raila. They were still friends with Raila. No, hiyo time ilikuwa bado ile time ya maandamano. Ruto was on this side. Ilikuwa zile time zenye Uhuru alikuwa anasema Raila is my leader. Politics, bro. So after they left the funeral, walienda mpaka this place in Bunyore, sijui ni Luanda ama ni wapi, then wakasimama, then they got out of their sunroofs na wakaanza sasa siasa. Mbona wafanyangi hivyo? Mbona na ukichunguza during the funerals of one of their own, they don't bring much politics. For instance, today they were burying an MP. Hakukuwa na so many politics. Of course, there were talks about roads. There were some people asking the president to build them a road in that constituency. Then the president addressed the SHA issue, but there were no much. Hakukuwa na politics sana. But when it's funeral, yeah, some of these nobodies, they wanaleta politics, they mess up the funeral and they just cause chaos. Just respect the funeral. If you've chosen to come to a funeral, just come there, offer your condolences, because there's a family that is mourning there. Wewe ukimake it up, because they're not kama that woman rep. She's not there to address SHA. She's just there to play politics of popularity. I mean, tango populism, that sort of thing. Just to she's a Gachagua, a Munyoro supporter or something. Just respect the funeral, and we are there just to condole with the family. And when you are done, go to the market center. Of course, people are going to follow you there. Fanya politics up. And so I don't know this preacher. I don't know if he's political ama he's
naambiwa hapa huyo preacher, he was back then in the state.
Alikuwa status some time back. I don't know about that. I don't know him, but I just feel like what he did was right, in my opinion. I don't know him. I don't know where he's coming from, but I think Lala will weigh in.
Okay, let us listen to Lala.
Yes. I don't know, but you know, when you talk about Kenyan politics, it is, you see, you have to look at the background, what was going on underneath, because politics play a lot. The question is, what was the perception of the priest saying, the pastor or the bishop saying no to these politicians? Okay. What was underneath? Like you mentioned, the man had been to the State House. Okay. The question is, if Ruto would have been there, would he have said no to him to speak? Okay. So these are the questions that we don't know. But from I agree with, you know, that they should not come and interrupt somebody's, you know, a funeral. I think the power should be given to the family to decide. The family should decide who is going to speak, the preachers and whoever out there. So I think the organization itself, before even the service, should incorporate people who have donated. Could have been those community donated, those elected people had an interest, and then they should actually discuss who will speak, and who will speak should be a decision of the family. This is what if we let our MP to speak or our pastor speak, whatever, I think that makes a lot of sense. And then they should address the issue of what message should be given out there. Because funerals in Kenya, we know very well, even the Ogola one had its own challenges that we all watched there, okay? Who spoke and why were certain people not given a chance to speak? I think politics play a lot, especially when it comes to funeral burials. So I may not fully endorse the idea behind people complaining, the woman complaining whether it's a Gashoga supporter or not. But I think the perception has always been there that funerals are a place where they have to say something. But in my mind, let the family decide. If this MP actually they wanted him to speak because this MP paid for one of this child's school fees and did something else, and they wanted to comment on that, that's the relationship that the family should decide. Okay, the fact that politicians should not speak, I mean, and the family wants the person to speak, I think we go with the family. That's my take on it, especially when it comes to a funeral, because it's an honor we are giving to the departed, and the people who are doing it is the family. But when politicians come and take over, or even the church should not take over either. Okay, the church are invited to conduct the ceremony, not taking over. But I know churches back home where they come and take over, the point where the family are not given a chance even to speak. Nimeona mara nyingi sana, which is not right. So I think it's a dishonor to the family when such things are happening. But the question is, how, what was it? What was the plan in the beginning? Because we know very well that such places, you somebody unampatia mic, alafu naita mwenzake, and then somebody else comes in, and could have been there was somebody in the congregation walikuwa nafikiri atafanya nini, atachukua to counter somebody else that was given a chance to speak. So politics is a terrible game in Kenya, especially when it comes to funerals. And so that's my take on it. But it didn't look good at all, especially for those that are bereaved. That's my take.
Okay, thank you, Lala, for that submission. Indeed, it's great. People, please welcome up because we are summing up. Please, I urge you, let's join up together so that we can sum up with strength together, or we can sum up together so that we not be left behind, or we can not be left outside the game, so that we be at the game. We rolling up as we continue moving on swiftly. Lala, today, President spoke about the story of SHA, claiming that SHA will strengthen, it will put everything in order for the SHA to work up. And he promised that he will make sure that we will not go back to the NHIF, so that those people who are leaking funds from NHIF will never get any cash from his government. And later, also yesterday, we also see that as we complain that also the private sector, they are complaining that the SHA is not functioning very well, and it's the project that will not even last for an year. So probably it will fail out. And they are saying that's why they are leaving SHA as private sectors. What can you speak about that?
You know what? I have a very strong view regarding the SHA. I listened to a portion of Governor Wanga, whom I respect, come from my constituency. I love her. I was in her home when I was recently there, but I disagree with her totally. And my reasons are, one, when you replace NHF with SHA, what you're doing is you're trying to give us a superior product that has gone through studies, that has got a different way, a different approach to the problem, that will answer certain questions that wananchi have, okay? That then you can bring a new product. But remember, when you bring something like SHA, the initial investment, the amount of cash that will be used to set it up is enormous, which means that that fund must come from the wananchi, because there's no money comes from another source. It's from us, from the people. Okay, so basically, what you've done is you've taken money out of NIS, NSF, whatever call it, NIHF, whatever, and you put that money for studies with, and setting up the system. And let me tell Kenyans, I was in a college in the US when I came here called Ashland University. When I came in, it was called Ashland College. Okay, it had been a university in the 1800s, but then because the white people did not want a lot of black people, so they returned to the name a college, but that was very limiting. So while I was there, the board decided to change the name from college to university. I think you can even go online. Millions was used, dollars, just the change of the name. Only this is a small liberal art college. Millions to change the the university and advertising and things like branding of letterhead, things like everything had to change. Okay, and that change itself was extremely expensive. Now, when you are changing a system because there's not enough funding, okay, it means that first of all you deplete it, get that money out before it can help anybody. Okay, that initial capital. And so the question is, was that the right way to use the money? Secondly, when you are changing a system and the sources of funding is the same, okay? Now the question is, why couldn't you simply use what you have and work on it, structure it, cut what is not necessary and invest in the area, use that one. It's almost like the way we did SRG. There's a line already, but what did we do? The old railway line, we decided to create something else, when actually you could have used the existing one. But we had to spend the money because people, that's why that thing is very expensive, okay? And it's not helping the nation, okay, the way it should have done if it were done differently. So what watu wamefanya is to start something which is rushed, because clearly it is rushed, okay? This is a major undertaking, it's rushed. That means they have not thought through the whole thing. That's why even at the initial stages, it has a problem. Worse than the old system, because it can't cover, adequately people. They claim that it's giving everybody, but at the end of the day, there's nothing much it's going to do, okay? So what you're doing is you're duplicating the same problem, and now you don't even have the structure that the old one had. Now you have to invent new ways. And so for anybody to go there, start defending SHA, when we can't see anything rational to make it better, which we could not use to make the other one better. The old NHF could have been better because we knew what it was. not doing. So simply what we need to do was to do a better job, make some changes, and let it cover the people. I think Ms. Wanga stated that it was only covering a small percentage. That's even better, small percent. Now you have to expand it rather than telling us that this now is better when actually it's using the same resources. So rationally, I don't know. Maybe you guys can help me understand the argument behind SHA is better. What is it that is doing apart from depleting our money, the initial cost, and things that have been thought through? Okay, the experts that came from the other side, we don't know whether they have been allowed in here. So I don't understand the rationale behind this SHA thing. And so to me, I think we could have saved money, used the old one, cut off the corruption, streamline the services, expand it to cover more Kenyans. It's been cost effective. It could have done much more. We could have used the whole hands that know how to do this job, and we could have cut, the unnecessary things out there. But coming up with the SHA, somebody has to convince me. I'm not convinced. Listening to Ms. Wanga try to defend it, I know her background is in the health system, which is a good background, but she's trying to defend something that should not be defended. That is my take on it. Maybe somebody else can help me understand the argument behind SHA is better. Maybe I'm not listening enough. I'm far away. Any of you can help me understand why is it better? What is it doing that we cannot do differently if we use the old method?
SHA is not doing anything new, or SHA is not bringing anything bold or something fancy, but it's just bringing the low problem that they were still back then. I want you to watch this carefully, and then you know where the problem SHA is coming from.
Every Kenyan is asking. The Auditor General has submitted a report to Parliament about the Social Health Authority procurement of systems. The amounts of money involved are crazy. 104 billion Kenya shillings. In your report, you have listed a litany of transgressions of the law, the Constitution, the Procurement Act, the PFM Act. You have said management was in breach of law. In several instances, you've said it almost 10 times. What these commentators on Radio in the Morning were asking, now that the Auditor General has said management is in breach of law, we are waiting for Parliament to go and whitewash the report. OAG, I can assure you that if that report is to come before this committee, we are not going to whitewash it. If you have gone to the ground, you have asked for documents, and you have found that 104 billion was spent on a specially permitted procurement procedure, which is contrary to the Constitution of Kenya. Do I need to get a governor to come and justify that the SHA was proper? And yet you are the one with the constitutional mandate to tell us whether resources have been used lawfully and efficiently. And so we must have this conversation. Once the Auditor General has said that the procurement of 104 billion of systems under SHA violated Article 227 of the Constitution of Kenya, violated the Procurement and Assets Disposal Act, violated the PFM Act, was not value for money. There were clauses and provisions in there that were not competitive. People were being locked in. There was a software as a service arrangement, which then does not confer ownership of the system to the citizens of Kenya. And you have said management is in breach of law. What else are we waiting for? Shouldn't we then be asking for administrative action, for people to be fired, for people to be investigated, for people to be arraigned in court? And those people are not just the people on the government of Kenya side, but including the system vendors. If there's a breach, then perhaps there are two parties to it.
We cannot continue using a system that is clearly a proceed of crime. It appears that the only people for whom SHA is working are the ones who are getting these commissions, the 2.5% from my monthly contribution. You have told us that they have to be paid on a daily basis. And yet the facilities themselves do not get similar treatment when they ask for reimbursement for their claims, Madam OAG. So can we, with finality, say something? Can we take drastic action? Because some of us do not mind being a bit rash if we are going to do something that is in the best interest of the country. Can we agree before this committee that we want to terminate that contract, and what are going to be the consequences? Because you can't continue to allow people to enjoy proceeds of crime. Let's just declare this SHA and SHIF a criminal enterprise, and we'll close it to date.
In every report that comes before you, where I pay attention to what Ruto says. So already I have concluded that there was no effectiveness or lawfulness in the use of public resources under those matters. Then I have the third section that now looks inward into the entity in terms of governance, in terms of risk management, in terms of the internal controls the Honourable Member is raising. And I also give a conclusion. And I said these matters have affected internal controls, or internal controls are not being followed. The governance structure has problems. There is no risk management. And hence, then we have all these issues happening under effectiveness and under the opinion matters fiscal. So my report is very clear on that I have already pronounced myself on the issues that were not lawful and that were not effective.
Our job would be to mete out punishment, to recommend administrative action, to recommend investigation and prosecution. The Auditor General has done the diagnosis. It is now time for Parliament to do the prescription. And that prescription is not about reopening the case, because it's the Auditor General that has done the case. The role of Parliament now is to prescribe, and to prescribe the stiffest punishment, even if it means discontinuation of the system, debarment of the service providers, investigation and prosecution of accounting officers, striking off the professionals from their professional bodies, the procurement professionals, the legal professionals, the accountants. I think that's what you're saying, that now that is the job of Parliament, to do the prescription. You have told us the patient is sick. We are now the ones to prescribe. And I hope that the National Assembly and all the various committees can speak in the same language to provide hope to the country, that these big issues you have raised regarding 104 billion Kenya shillings is not going to get lost in the mud of political.
Well, that's what's not happening, or that's what is it.
Wow. I think I didn't hear that, but that's to the point. Actually, that gives us a better understanding of how things have been done. It was rushed, not thought through. And how do you run a nation, with such kind of people? I mean, where did they come from? What are they doing? And even you, if you want to build a little hut in your village, you gotta get in Somali, you gotta study, you gotta make sure this is the right place. Nitajenga hii nyumba yangu. And there's at least some planning. But this is about money. It's not about any plan. It's about how to spend the money. And anyone authorizing that should go to jail, should be prosecuted, because this is not how to spend, add and funds that wananchi struggle, to get to pay that tax, just to be used in this kind of careless manner. So that is shocking, that this administration did not care about the three branches, whom to check on. They thought this was their prerogative to spend and use taxpayers' money with no check and balance. That's exactly what they have done. And so these are criminals. I agree with the senator 100%. Those the senators who are asking for prosecution and investigation and prosecution, and it's sad, very, very sad, because this is supposed to be a younger group, people who know better, who should more technocrats, supposed to be the one working on all this stuff under a PhD holder, the president, to see some things like this happening. This is purely criminal. Back to you.
Thank you, Lala, for that submission. Indeed, it's great. Please, I urge people, we are doing this, and I'll still continue reminding you that we are supporting Sound Country Talk. I'll be checking back the comment section, but before I go back to the comment section, what our comment section, I want you to do me a favor. Let us support Sound Country Talk. The details are on the screen. We are using Bernard's number so that we can help also, we can make sure Bernard gets the medication. Also, we are supporting Sound Country Talk. So let us choose the number, Bernard's number. Make sure you check on Bernard. He's not feeling quite very well, but we're still putting up so that he can have good medication. So we are using the Bernard number, which is on the screen, is +254 718 454 585. The name will bring Bernard Makoha. So use the details, support Bernard, help Bernard so that he can have a quick recovery, so that we can continue hosting the show with Bernard. So the details are on the screen, please. Cheza kiwewe kama Mkenya, ama sio? Yeah?
Bernard ni mgonjwa.
Bernard's not feeling well. Yes.
Oh. Pole sana.
Bernard's quite feeling well. So please let us do this something so that Bernard can at least get the good medication. He's really struggling, even for moving one point to another point. It's a little bit uncomfortable. So let us do something so that we can help Bernard. Also, the details still scrolling on the screen. You can still see them. Just use them so that we can make Bernard feel good. We have been standing here. Bernard has been here every day fighting for us, keeping us here, helping us to move on. And now right now is the time Bernard needs us. So we have to stand up and make sure that he gets good and proper medication so that we can continue having Bernard inside the show. So I appreciate for everyone who sent a little, everyone who will touch in seat pocket. Please let us do so that we can continue going ahead together. Okay, as we also drop that, I still remind you that please continue subscribing and continue sharing the videos so that we can have the conversation together as even we're coming to the conclusion. So Lala, today we'll play a lot of videos and a lot of things happen. Today we see during the funeral, there's not a lot happened during the funeral, but we still have the views where the Ruto spoke about SHA, and that is it. Also, the SHA people replies towards that and other things little bit happening. But as we are summing up, I just want to briefly, apart from where I'm getting the show and up where we are, I know at least you have some context of one or two the things that are happening, or one of the two the discussion. I want to bring to you just tell us what is your take, or what can you speak on about making sure that Kenyans move ahead, despite of SHA or despite of everything, that should be able every Kenyan to get a medication. I asked Douglas earlier, if I'm having an ATM, I can withdraw money in any bank as long as it's for the same bank. Why can I have a medical cover, a medical visa that I can't swipe in every hospital that I go, as long as the hospital have the same services? But if I, like, for example, like SHA or the NHF that has been done away, is that you are supposed to be registered at a certain hospital. If you are in Mombasa and you get sick, it means that you came out, we go from Mombasa, go back to Nairobi where you register the NHIF or the SHA process, and then now you get the medication. Then you'll go back in Mombasa. Why should they not make it work, be mobile, whereby if I can Mombasa, it's like an ATM. I can go swap and be treated there. I can go swap and go being checked in clinic there. I can go swap, check in clinic in referral room, like in Kenyatta referral. What's your take about
that? Shadizo and Douglas, you're young people. I think you got a lot of fight ahead of you, and you cannot slack, because we have sold you a raw deal, my age. Because here is an example of something that to me is shocking, and it's not right. if I have an insurance, which I do have, okay, yes, I have a hospital in the state where I am that I go to where my doctor is, okay? But if I happen to be sick in another place, like right now I'm in the US, but tomorrow I'm going to be in Jamaica, okay? I get sick in Jamaica, okay? I can simply call my insurance, okay? And they will authorize treatment where I am, and the reimbursement is given. There are some insurance which are a little bit more stricter. But anyway, in the US, if something happens, there is an arrangement. That's why it's a nation. That's why it is one. Everything is integrated so that my health portability, any doctor seeing me can be able to look at my chart, okay? Authorize them to look at my chart. In other words, the work is easier that way. Is even their insurance here in the US, where they actually would allow you to get treatment anywhere in the world. Even they pay for you when you go out there and stay there, because it is one system. So if we are going to have a health insurance in the nation, at least it should work anywhere in Kenya. There's no reason why it cannot work in Mandera. The same one cannot work in Homa Bay. Okay, I think it should be integrated, and that's what a nation is all about. So for me to be sick and then I have to find this particular place to be, that's not right. Okay, and it's supposed to be healthcare. Healthcare means there are other facets of medical services that focus on more prevention and well as intervention. And actually, if you do prevention, it means somebody's sick in Mandera and you don't get treated till you come back to Nairobi. Actually, that is so expensive. The services, ICU services, are extremely expensive. But if you can get treatment immediately where you are actually reducing the cost of healthcare. So these are factors that why they don't get it. And these people travel. We see them here in the US, travel all over, and they benchmarking, whatever you call them, they're all over, supposed to be learning. What are they learning from other systems around the globe? They're using taxpayers' money to travel everywhere. At the same time, we are having some of these simple issues that they should have learned. They don't even need to come out here. They can do it right there. Where somebody, if you have insurance, let it work anywhere in Kenya. Thus, those are the same, that's the same system. And in fact, right now, they should have been thinking of let it work across East Africa. Why do we have those so-called, those countries together? Why can't the insurance plan work in Rwanda, in Uganda, and Tanzania, and other places? We should have been thinking that way. For us to have this discussion within Kenya is stunning to me. It's very sad. It shows how little we care about each other, care about development of our healthcare or other system that we have in our country. So that's my comment on the topic that you raised. Back to you, Chedizo.
Thank you, Lala. Douglas, as we summing up, any closing remarks? Any closing remarks as we summing up?
My closing remarks is let's fight for the independence of our institutions. At this point, they're the only thing that is holding our country together right now. There's a threat to them. I don't know if Lala's come across it, but there's a bill that has been doing rounds on social media that Gichugu has proposed a bill in Parliament to strip the Auditor General of the powers to be the official national auditor of government and bestow that powers to Parliament. And that's just a way to avoid accountability and scrutiny. And as Kenyans, just need to continue pushing back against such excesses by the government and ensure that we reach to a point where the rule of law is upheld in this country and our independent institutions are allowed to work as they were framed by the framers of the constitutions, by the constitution. Yes.
Thank you, Lala.
Can I say something?
Yeah, go on.
Douglas, I've not heard what Gichugu stated, but this is my take on it. Even in different systems, whether it's the US or other places, where we have commissions or maybe a parliament, even a parliament would choose someone empowered to investigate and do the service which collectively a commission cannot do. They still need independent investigator. They still need somebody to lead a particular pointed investigation and assessment, whatever you want to call it, of whatever it is that's going on. So to hear Gichugu suggesting that that office should be abolished and given to a commission that will do nothing, why do we choose independent people to investigate? It's because when one person is in charge, there is only one center. They're able to focus on that investigation. So for us to get rid of the Auditor General is, to me, is to weaken the management of our resources, to weaken the system, and to basically allow the executive and allow the parliament, where there are so many views at the same time. Basically, you are basically cutting, closing your independence, closing the investigation and the oversight of that particular specific area, and you're leaving it to the hands of these people who, in my mind, do nothing. They just talk. The lawmakers, but the office is Auditor General is someone who is investigating, somebody who is actually closer to the administration, to the executive, than really to Parliament. Even though the reason why it's independent, because it covers, or she covers, both areas, both ends, with that lesser beam, focus on that particular work. So Gichugu's suggestion is wrong, is bad, it is dictatorial, it is part of Ruto's scheme to become a dictator. That's what I would say. Back to you.
Thank you, Lala, for those submissions. It is good. Thank you, Lala, for also joining up the show. And also thank you, Douglas, for staying up. I will still really appreciate for you guys coming through. I think we are bringing the day to an end, and I appreciate for those people on the comment section. But we thank for everyone that's doing it. But what I remind you, let us do so, and also let us tell others, please let us make sure Bernard God gets good medication so that he can come back. So let us please encourage one another. Let us do things. Use the number. Bernard number is on the screen, is scrolling down on the screen. Let us use it, and let us help him make sure that he gets good medication and he recovers quickly so that he can come back. I appreciate for everyone and people also on the back and people who are watching. I don't have much to say, but to just appreciate you indeed, because you are true Kenyans, you are true patriotic, and indeed shows that you love Kenyans. So, you love Kenya. So I'll pull it to an end, but don't miss tomorrow daytime. We're having a show called Church Bulletin. So please get in touch. with that. I don't have much to say. Till next time. Bye-bye.